Hello everyone, welcome back to Corpus. Low back pain can be because of various causes, because of various reasons. Like in our last video, we saw how in females, low back pain is caused by wearing high heels. Similarly, in general population, including males and females, low back pain can be caused because of muscle injury, any kind of a ligament injury, any kind of a mechanical vertebral problem, or muscle weakness. Today we are going to discuss about low back pain caused because of muscle weakness, and that muscle is called as core muscles. Some of the important core muscles are your transverse abdominis, which is a part of your abdominal muscle, then multifidus, it's a short muscle which is present at the back in the spine here, and pelvic floor muscles. So these muscles mainly help in giving stability to your spine. So all these muscles, they surround your spine, so from here to here, and they give stability to the spine. So these muscles, when they are strong, the spine will get the stability, the spine will be strong, and you will not have any kind of a back pain. But if these muscles are weak, then it can lead to spine instability. The spine will be unstable and you will get the back pain. So if your back pain is because of spinal instability, then you need to strengthen these muscles in order to get rid of the back pain. Now, how you're going to come to know that this back pain, what you're having, is because of spinal instability. So what are the signs of spinal instability? So first important sign is you will have a recurrent back pain. Recurrent back pain means if you have a back pain now, it will get relieved because of some treatment, and after 10-15 days it will occur again. So that is recurrent back pain. The second one is when you are changing positions. If you are standing here, if you're moving, if you're bending, you will get an instability catch. Means you will feel your spine is a little bit unstable here, something shaky feeling, and you will get a back pain. And third important sign is external support. External support means if suppose you have a spinal instability, then if you suppose get down, and when coming up, some people take an external support on their thighs to get up, okay, to avoid the back pain. And some people, they move their hand at the back, they support over here, and then they move down and come up. So you need that external support in order to move and do your movement. So this is one more important sign saying that you have spinal instability. So now let's see simple exercises to strengthen your core and to get rid of this spinal instability, low back pain. The core exercises what I'm going to show you now are the simple core strengthening exercises. So to do these exercises, you have to first learn how to draw in, how to activate your abdominal muscle, that is your transverse abdominis, part of your abdominal, your stomach muscle. And for that you have to draw in, suck your tummy in, and this is done in this way. Now to activate your abdominal muscle, that is your transverse abdominis, you can see over here my stomach is in a resting position. It's completely relaxed, and to activate that abdominal part, you have to concentrate first on this area of the stomach, that is the area between your belly button and your waist. So this area you have to suck it in, you have to squeeze that area of the abdomen. So here you're going to activate transverse abdominis, that is one of the important core muscles. So this is relaxed position, so you have to put it in, you have to draw your stomach in and hold it tight. You should feel a kind of a tightness and tenseness in this area. That means you're activating transverse abdominis muscle. So to start with, the first exercise is you have to lie down in this position, and you just have to suck your tummy in and hold it for around 5 to 10 seconds. There should be proper tension building up over here, and then you leave. Mind that you have to keep on breathing while doing this. When you're sucking your tummy in, you should not hold your breath, but you have to keep on breathing. Next one is you have to lie down completely straight, so keep your legs down, and then the same technique what I've shown in the first exercise, draw your stomach in. This portion of your transverse abdominis, the lower stomach area, you have to draw it, suck it in, hold it for 5 to 10 seconds, let the tension build up, and then relax. Hold it in and then relax. In this exercise, you have to lie down in this position, and what you have to do is you have to press the ground with your lower back, and when you're doing this, you have to suck your tummy in. So suck your tummy in and press the ground very hard. Let the tension build up in your stomach and then relax. Keep on breathing. So suck your tummy in and then press the ground with your lower back. So let the pelvis tilt like this. So suck it in, press the ground, hold it for 5 to 10 seconds and relax. So in this exercise, you have to be in this position. Here, what you have to do is you have to suck your tummy in, let the tension build up, maintain that contraction, and at the same time, move your leg sideways, right and then left. So when you're moving your legs, you have to control this tension and you should not lose this tension. You have to control your muscle contraction like this. Move your legs in and out, but maintain the tension. You can even move it sideways at the same time and move it in, sideways and in, and relax. In this exercise, we are going to activate transverse abdominis, your abdominal muscle, as well as we are going to activate the glutes muscle, which will give you extra stability to your spine. So here you have to do a bridge first, squeeze your buttocks and suck your tummy in. Hold both the contraction at the same time, keep on breathing 5 to 10 seconds and then leave. Again up, here you're activating your glutes, then suck your tummy in, maintain the contraction, the tension, 5 to 10 seconds and then leave. In this exercise, you have to suck your tummy in, maintain the contraction, you can press the ground down and then move your leg up slowly and down. Maintain the contraction, you should not lose the tension building up over here. So suck it in, squeeze, press the ground, up, down, up, down. The next one is the cobra pose. So to do this, you have to lie down on your stomach. So you can keep your hands like this, and you can keep your hands like this also. So when you're keeping your hands like this, what you have to do is you just have to move up and lift your chest off the ground, and you will feel a kind of a tension over here building up. You have to hold it for 5 to 10 seconds and then leave. If it is difficult, then you can move your hands like this in front and then move your chest off the ground. So here again the tension will build up over here. You have to maintain that for 5 to 10 seconds and then leave. So these are the simple core exercises you need to perform only if you have a back pain, and that back pain is because of spinal instability. And the progression of these exercises, the more difficult exercises to strengthen your core muscles and to impart stability to your spine, we will be showing this in our upcoming videos.
For more content on health and fitness, do like our video and subscribe to our channel.